Namaste and welcome to yet another episode of the Influence Academy with myself, Anusha. The motive of this show is to share stories of various personalities. We talk about their journeys, their struggles, and their views on varying aspects of life here in Australia. We hope to bring inspiration among all Nepalese and the world at large. A quick mention to our sponsor, Extra Tech, a professional IT job-ready training institute here in Australia. And secondly, 3B's Education and Visa Services, a leading educational consultancy here in Australia. Today, I'm accompanied by Mrs Anu Upadhyaya, who started her career as a registered nurse back in Alka Hospital in Nepal. And currently, she is a general manager at Australia's one of the biggest health and care company, Bupa. In tonight's conversation, we'll be discussing nursing as a career, what it takes to be successful in this field, and what are its challenges and opportunities. So, ladies and gentlemen, without further ado, let's welcome Ms. Anu to our show. How are you, Anu?
I'm good, thank you. Yourself?
Good, thank you very much, and I'm really glad to welcome you to our show.
Thank you so much for giving me this opportunity to be here, to share my experiences with you guys. I'm very grateful. Thank you.
So let's start this conversation with a personal question. So nursing as a career is very challenging.
Yeah.
The hours are odd, the stakes are high, and yet many students aspire to be a nurse. So what was your inspiration to choose nursing as a career?
Okay, so when I was a little girl, I used to get really sick every 15 to 20 days. So my parents used to take me to lots of medical centers, hospitals, a lot of healthcare centers to get me checked. And I used to see lots of nurses looking after patients and taking care of those patients. So at that very moment, I thought, this is it. This is wonderful. They are so wonderful. I saw them taking care of sick people who needed help. So I thought, I'm going to be a nurse. I was very young, very little at that time. And then later on after my SLC, I started to think that, okay, I'm going to study nursing. My parents weren't convinced in the beginning because I used to get quite sick and they used to think, oh, there will be night shifts and all these sort of shifts. You won't be able to cope. So I said, no, I'm going to do it. So I did it. Studied nursing, started studying in 2004, finished my nursing in 2007. After that, I started working in Alka Hospital, worked there for about 2 years. I also worked in non-governmental organization called SAATHI at that time when I was in Nepal. So SAATHI was an organization which looked after women and children suffering from a lot of abuse and discrimination, different sort of things. So yeah, that was a journey in Nepal. So yeah, in 2009 I came to Australia to study Bachelor in Nursing. Did Bachelor in Nursing for 3 years. While studying nursing, I was working as an AIN, and after graduating as an RN, when I got my registration, I started working as an RN in an aged care. About 1 year after I started working as an RN, one of my care managers resigned at that time. So the general manager at that time was very supportive, and she said, do you want to give it a go? Do you want to do it? And then at that time I thought, oh, maybe I'm not ready. I'm too green. I just have 1 year of experience. I'm not even experienced to do a managerial role. So she said, look, if you don't try it, you'll never know. So I thought about it, and then I thought, all right, I'll give it a go. I'll do it. So since 2013, from 2013 till 2017, I worked as a care manager. In 2017, I started working as a clinical care manager, and then after a few months, I think about 1 year later, I started working as a chief nurse. And then at that time, one of my regional managers told me that there's a general manager's role in one of the smaller homes in the same organization. So again, I was very unsure at that time. I was unsure whether I wanted to do it because general manager's role was a big role. It is a big role. So yeah, I spoke to my family, my husband, everyone, my close friends, and they said the same thing. If you don't try it, you won't know it. So I thought, all right, I'm going to get out of this comfort zone and I'm going to try it. I'm going to give a good shot. So then I started doing a general manager's role from late 2017, early 2018, and till now I'm doing it.
Wow, Anu, thank you for sharing your journey, and we will talk about that later.
Okay.
I would just want to ask you one important question for now. Being a healthcare worker during a pandemic is a lot worse than a war.
Yeah.
I mean, at least during the war, we can see the enemy, but with this current COVID-19 crisis, the enemy is invisible, and the healthcare workers have to face it head on.
Yeah.
So what were the challenges that you faced or are you facing during these hard times?
Look, I work in an aged care. So aged care being a very vulnerable industry where we have a lot of elderlies with lots of comorbidities and lots of different conditions. It was very difficult in the beginning, very, very challenging. But having the whole team together, doing a lot of education sessions, just being conscious around the whole thing, raising the awareness among staff members, visitors, everyone, that was the key. And just basically being aware, making sure doing lots of hand washing, making sure following a lot of infection control protocols and procedures. Just being aware was the main thing. Just being aware, and just thinking about on safety and vulnerable population safety.
Like, since I'm privileged to share, share my audience with you, I just want to share that I salute each and every frontline health workers for their enormous courage. I mean, they literally put their lives at stake to heal others. That's really amazing.
I mean, leaving your family members behind and coming to work, looking after your patients wasn't easy, but everyone pulled in together and just kept going.
As you shared your brief journey with us, and moving on to your career, you started as registered nurse in Nepal. You came here, you did Bachelor's of Nursing, then you did Master's in Advanced Clinical Practice, then you started as Assistant to Nursing, then you were a Chief Nurse, and finally you are like a General Manager in Australia's one of the biggest health and care company, Bupa. So what were the essential qualities that you had, like that helped you to climb these positions? I mean, I don't think it's easy.
It's not easy. So I want to say being accountable is the most important thing. You have to be accountable for everything that you do. Having a very good work ethic, being honest, and the one thing that I always think about and I always share it with everyone, getting out of that comfort zone and grabbing every opportunity is possible. So the moment you feel too comfortable in that square, that's when you stop growing. So just getting out of that comfort zone, because the moment you feel too comfortable in that square box, that's when you'll stop growing. So it's about grabbing every single opportunities and just being upfront and just giving it a go, because if you don't try it, then you'll never know what it's like, isn't it?
And also in Nepalese community, nursing is apparently a very popular choice, and numbers will grow in future as well. So what should a young student looking or currently starting nursing watch out for? And in your opinion, like, what qualities should an ideal nurse have?
Look, a nurse should be definitely passionate about providing care, because nursing is not just a job. It's a feeling. It's because you'll be taking care of someone. So it's not just, I just want to say to the younger nursing students or younger nurses, don't take nursing just as a job. Make it your passion, because someone's health is in your hands. So you just have to be very careful and just be caring, passionate, be very, very honest. And again, same thing, you have to have a very good work ethic to do that.
What sort of work ethic are we talking about?
Like being reliable, gaining that trust, developing a very good interpersonal relationship, and having good communication skills is very important.
with patients?
With patients, yeah, and their families. So looking after a patient comes together with a package. You need to look after their family members and friends as well, because whenever someone is unwell or ill, their family members will be very concerned as well.
They will be very, very vulnerable.
Yeah, absolutely. So that whole package comes together. You need to look after their families and friends as well, and just provide them constant support, emotional support, all of that.
So apart from the nursing training that people get, like they learn how to be a nurse, all the clinical stuff, do you teach them like all this interpersonal stuff too, like how to handle the patients, how to talk with them, and that sort of thing?
Yes. So once the registered nurses graduate and receive their registration, we do a very thorough induction program and body program as well. So during that body program, there's a lot of things to learn, like how to deal with someone, how to develop that connection with someone, how to find out what that person likes, like all those sort of things, routines, schedules, how does this thing work, all of that. So just nursing training is not enough, but there should be a lot of exposure as well, a lot of practical experience and things like that that helps. So even in nursing, during studying nursing, there's a lot of practicals, clinical placements that students have to go to, where they learn a lot. They get exposed in different areas, like for example mental health, aged care, acute care, ICU. There's all different areas and sectors. So they get exposed to all of that.
And moving on, I think nursing is the only field where women have majority, compared to any other careers. And so, however, the number of male nurses are also on the rise. So, in your opinion, like, why is that the nursing career is more favorable to women?
I think it's about the female nature, because we females are very caring, aren't we? So I think it comes from the care side of it. But in saying that, no, I have worked with amazing male nurses as well, who's been excellent. So I guess back in Nepal, we used to have only female nurses, but here in Australia, there's male and female as well. So now the time is changing. I have seen lots of Nepalese men studying nursing here in Australia. So I think that's a really good thing, because I don't think a profession should be considered a female-dominated profession, isn't it?
I came across an article from the Kathmandu Post, and it says like out of 13,465 registered nurses in Nepal, and among them only 125 were male. So why was the scenario behind it?
I believe it could be due to lack of awareness, because most of the people think it is a female-dominated profession, so maybe most of the male are not comfortable going to that field. Maybe that's why, I think.
But in here,
it's completely different. There's so many male nurses, and that's a really good thing, Yeah, in the past days, it used to be a female-dominated profession, nursing, but now there's a lot of male nurses as well around. So I think it's really good, because male are very, they can care for people as well. I have seen a lot of very caring male nurses, and they are excellent. They are really good.
So moving on, in Australia, majority of aspiring or new nurses start their career being an assistant to nurse, AIN, and they just, even though when they're not nurse, they hear about AIN opportunities, and they enroll in the opportunity doing some certificate level courses, and then they also aspire to be a registered nurse in future. So how can they grow to be a registered nurse, and what should they focus to reach the managerial position, like within the nursing department?
Just being accountable again, doing the nursing degree. So yes, being an AIN, you are already exposed to the care environment, so you already know how to care for someone, because assistant in nursing is basically a nurse who takes care of someone and looks after someone. So you're just going ahead and doing your nursing degree and becoming a registered nurse after that.
Yes, thank you for that. And also, I just want to ask you that particular, like, what to focus on to reach the mandate push. Not every one of us could reach that position. I mean, not any of us can. What would they need to do to achieve that?
As I mentioned before, how I grew in my career, I just grabbed every single opportunities that was in front of me. And just kept working hard, kept focusing on career, just raised my hand up every single time. And main thing was getting out of that comfort zone, because as I said before, you won't grow if you are too comfortable in one area. So if you want to grow, you need to explore further and just step out of that.
What is the difference between an aged care nurse or a clinical nurse in terms of post responsibilities and skills?
Clinical nurse have exposure to different patients in hospitals. For example, someone might get unwell and come in for a shorter period of time and leave, whereas in aged care, there's elderly population, elderly residents there for longer period of time. You get attached. You have that special connection with elderlies. It's very different. Clinical care, acute setting is very different from aged care, because in acute, it could be anyone, it could be an elder person, it could be a younger person, it could be anyone, but in aged care, there's only our older generation who need a lot of support and a lot of care.
Moving on, managing time in any field is very crucial for success, be it in trade or healthcare or construction or engineering, IT or accounting. One has to have the ability to manage their time efficiently.
Absolutely.
So how can an individual in nursing manage their time efficiently, as nurses are so so they are so dynamic in the profession. They have to be prompt, and they are on the go every time they're on the go. So how can they manage their time efficiently?
So it's about being more organized. You have to be very organized and prioritize what's important, what's the most important. Do that at first, whatever is the most important thing, and what's the least important thing, do that at last. Just setting up the priorities, setting up your goals, having a schedule for the day, having a tick sheet. Just being more organized, I think, and communicating with your team, because communication is very important in nursing roles. So communicating with your team, delegating work as possible, because you're only one person, you won't be able to do everything on your own. So you need the whole team together with you to achieve something. So it's about teamwork, working together as a team and just sharing workload together.
Moving on, there are many free resources on the internet, to study anything. And being a nurse, we have a certain, course structure that they follow. But where would you recommend student, which place do you recommend student for research?
Where they are studying in that university, there's libraries and databases available for all the students. Reach out to your library. There's a lot of books and lots of documentations and articles that you can extract from the library. Also, when I was studying my master's, I used to use a lot of databases such as CINAHL, PubMed, all those different research databases. And that's how I used to get lots of research articles from there. And every university will give access to those databases to all the students. So do a lot of research, use those platforms to extract research articles and do a lot of research and studying, because they have best evidence practice documentations and articles.
So Anu, we're coming to the end of our program, and I would like you to ask a very interesting question. What are the 3 things that you've done, differently, if you have a second chance?
I'm very happy with what I currently have. The only thing that I can think of, so early in my early days here in Australia, we didn't have a big support network. We didn't have a massive Nepalese community as well at that time. So if we had a big network or if we had a big support, then maybe I could have had more support in early days to find a job or something, because in the early days I did struggle to find a job when I came here in Australia because of lack of networking. And here in Australia, everything runs by the references. So at that time, there were no one to give me any references. So I struggled to find a job in the beginning. So yeah, if I had a big network or if there was someone who I knew professionally or someone that could have made a difference, I guess.
In your case, you would reach out to more people.
That's right.
So before signing off, would you like to say some few words to our viewers, all the viewers, and also especially who are, looking forward to be a nurse?
Yeah.
So would you like to say some few words?
Yeah, absolutely. So keep working hard, always believe in yourself. Whatever you do, always respect your work, no matter what the role is or what the job is, respect your work. And just be honest and accountable, that's all. And I would also like to take this opportunity to thank my parents, who's always been there for me since the beginning. They've always encouraged me and supported me and motivated me to get better. My mom and dad, they've always worked really hard in their life, and I've seen them work. So that's how I got this motivation from them to achieve something. So yeah, I can't thank them enough for everything that they've done for me. And I would also like to thank my husband, who's always there for me, always by my side, pushing me, encouraging me to be better version of myself, and looking after me and my family and my friends, my sister, my colleagues, my entire team at work, my mentors, everyone, because without them, without their encouragement and support, I don't think I would have been here. So I just want to thank them all.
Thank you, Anu, for sharing your really busy schedule with us and sharing your journey with us. And I think that these conversations will inspire all people, not only just nurses, but all people, like how you've achieved things, how you achieved, your ladder, your manager, being in a position of manager position in Australia is like a biggest deal for us. And I really applaud you for that as well. And thank you so much for your time.
Thank you so much. Thank you, guys.
Thank you. So on that note, I would like to end tonight's episode. We'll be back next week with more influential stories. So until then, stay influenced, take care, and thank you for watching Everest TV. Thank you.